Hi, everyone. Welcome to the last edition of our video series for Nurses Week. I have some very special direct patient care nurses here with me today who we're going to interview and you'll get to learn more about. So we're going to start off by asking them to introduce themselves. Michelle, do you want to get started?
Hi, my name's Michelle. I'm one of the nurses in the Central Maryland office, and I've been a nurse for 10 years.
Carolyn?
Hi, my name is Carolyn. I'm a nurse in the Suburban Maryland office, and I've been a nurse for 16 years.
Jinwan?
Yes, my name is Jing Huan, last name Hamilton. I'm working for Virginia side. In Virginia side, smaller team, but we cover a big area.
Region.
Yeah.
And how long have you been a nurse?
When I was 20 years old, I was a nurse in China. I came here in 2001, and the license would now be recognized. I have to start from the very beginning. And being a CNA and LPN and RN and BSN, and I went through all those for almost 10 years. And finally, I got my BSN. My next challenge goal will be a WOCN.
Wow, that's fantastic. A lot of school.
Yeah,
a lot of school.
Veronica already gave me some information.
That's fantastic.
Great.
All right, Donna, will you introduce yourself?
Hi, my name is Donna Cherry. I'm a clinical lead in the DC home health side of MedStar. I've been a nurse for 15 years.
So Donna, tell us, what made you choose home care? Why become a home care nurse?
The flexibility. So I worked in the hospital for 9 years. I left the hospital. I went to hospice for 3. From hospice, I came to the home care side. I like the flexibility. I like not having to work every other weekend in the hospital. I just really like the interaction between what we do for the patients and how we help them. Sometimes I think if it wasn't for what we do, or sometimes us putting eyes on certain patients, they would probably fall by the wayside. So for me, that's it for me for home care. Yeah.
All right. That's great. How about you, Carolyn? Why did you choose home care nursing?
I chose home care nursing because I enjoy being able to connect with my patients. In the more acute settings, it feels like there's always something pulling you away or 15 other things you're thinking about. And when you're doing home care, you're in the patient's environment, you can make immediate effect on what their needs are, and you can really connect with them and personalize the experience.
All right. Now, Michelle, I want to take the next question to you. What do you think is one of the greatest challenges that nurses experience in home care that you might not experience in other settings?
I think sometimes in their own environment, you have to, build that rapport and get them to trust you and welcome you into their home and learn their family and their support system, learning their barriers and what resources you can help them with to be most successful in managing their health.
All right. Jinwan, how about you? What do you think is most challenging about being a nurse in home care?
Being a home health care nurse, most of the challenge is I'm alone in the patient's house. When I work in the hospital, I have a whole tons of the doctors, physiotherapists, and the nurse manager and the charge nurse. Everybody go with me when I yell, and everybody come help me. But in the patient's house, I have to use my own judgment and find out what's really going on. I will give you an example. I was assigned one of the IV nurse 2 weeks ago, and the patient discharged from the hospital the day after, on previous day evening. And when I got there, start to do the IV, I find patient is blind, not able to see anything. And the IV, how can we do the IV with gravity, with blind? Okay, I
Right.
cannot agree. So I immediately called the Corin and see, you need to change the elastic ball.
Yeah.
Patient had previously experience with elastic ball, might be able to do it. But I told the patient and called the doctor, because we don't want to miss the dose. Today, we need to infuse the 1 dose. And then tomorrow, you need to change the elastic ball. And the other caregiver will come over. We're going to start teaching again. But next day, when I get there, the patient said, okay, I just finished the dialysis this morning. I feel chill, feel something different. And the temperature is good. But finally, I sent the patient to hospital because he got a COVID. HIV positive. So for the nursing, most of the challenges use our own judgment to do. Definitely, we're gonna follow the doctor's order, doctor's instruction. But in the home setting, we have to use our own experience to taking care of our patient.
I have to say that's one of the things that I observe the most about home health care nurses is that you really have to be a jack of all trades. You don't have the privilege of, you know, when you're in a hospital, you could focus in a particular specialty. You guys have to do it all. You have to be able to figure it all out. And if you go into a patient's home and it's something you've never seen before, like you said, it's a challenge, but you've got to figure it out, right?
Figure it out. Yep.
Yeah. All right. So I want to ask Donna, what do you think is the most rewarding thing about being a nurse in home care?
For me, it's seeing them when they come home. They're weak. They may not have a lot of education based on whatever their disease process is. We can go in there and we can teach them about their diabetes. We can teach them about their heart failure. If they are on Melrinone, we teach them how to care for their pit dressing, how to administer the medications. Just seeing it from infancy to adulthood, I would say. The teaching that you can do with the patient, setting them up with resources. I actually love it. Sometimes I hate to discharge people because, like Jiwan said, you go into the house, it's just you're one-on-one. Michelle said you have to build rapport. You know, you respect people's belongings, but after you come, you're there maybe 3 times a week. They're like, okay, you know where everything is, go get it. You know,
You're part of the family, right?
yeah, you are part of the family. I love it when the plan comes together, when it all works out the way you wanted it to, and people can stay in their home. They can stay in their home without having to go. Maybe, they want to be independent, excuse me. They want that independence, especially our older people. They want to be independent and be able to stay in their home, but do it safely. So for
Right.
me, that's rewarding. Yeah.
Great. How about you, Michelle? What do you think is most rewarding about being a home care nurse?
I agree. Just being able to see the progress and see it all fall into place and know that a lot of times people just want you to listen, and being able to be there and help them through whatever is they're going through. Because again, in the hospital, you're pulled in 1,000 different directions and it's such a short stay. You don't get to know them on the same level that you do when you're in their home multiple times a week for several weeks at a time. So it's just nice to be able to put it all together and get everything that they need to be successful. And when their family reaches out to thank you, for being there and helping them and having them reach their goals, that's really what makes me feel good about it.
That's awesome. All right. So I know that there are a number of careers that really define who people are. And, a pastor is a good example. Once a pastor, always a pastor. And it seems like healthcare careers are very similar. And I've seen that of nursing. So, Carolyn, I want to ask you, do you feel like being a nurse defines who you are? And if yes, how so?
Yes, I do. I do feel like it defines who I am. There have been times in the past when I was really challenged and I questioned, is nursing for me? Is this something, and I've always known the answer has always been yes, that's where my passion is. But, what does it mean to be a nurse? Is it just giving medications to treat a disease? And I always tell people that it's so much more than that. It's helping people through a difficult time. It's sharing my knowledge so that people can get better. We spend a lot of time on our education and a lot of effort, and to be able to give that to other people who are in a difficult situation and take them from, I have no idea how I'm going to do this, to, wow, I'm doing this and I'm managing it and things are getting better, to kind of guide them through that process. I think that's what nursing is. We do have medical interventions, but so much of it is just walking the path with our patients in helping them reach their goals. And I took a year off one time and I still was nursing people. Like, I didn't even know I was. It still was like, okay, so, I'm like doing nursing diagnosis in my head, like, okay, what can we do? I still was doing the process. So it's something that's like inherent inside of me.
Yeah.
How about you, Jinwan? Would you say that being a nurse is part of who you are?
Yes, I'm the nurse. I will be the nurse all my life. I don't think I will retire. And talk about the previous question you asked. I will give you the example. I just joined the team with Dr. Fraser 2 months ago, and I was sent to the Baltimore from Virginia Fairfax. I drove 118 miles to that patient with folic acid blockage, 83 years old guy, and there's 800 cc. I didn't drink the 800, drink the 500. I take the break and drink another couple hundred. And after that, the patient said, "Oh, Jinhuan, what do you want? You want money? Oh, you want to drink? You want something to eat?" It's 12 o'clock, midnight. I sat down in my car. I want to cry. The patient, that's the way he showed how appreciate for the nursing, for MedStar nursing. That's the something make me feel better. When I see the patient feel better, I feel better.
Yeah.
Yeah. That's great. Well, thank you all so much for sharing your stories today, giving us perspective on what it's like to be a patient care nurse and the most rewarding and challenging parts of the job. We appreciate what you do every day. I want to make sure I wish you a happy Nurses Week, and thank you so much for joining us today.
Thank you.
Happy Nurses Week.
Happy Nurses Week.
And with that, we conclude our week-long Nurses Week series. Thanks everybody for watching. Have a great rest of the day. Bye-bye.
Thank you, Carrie.
Thank you.
Bye-bye.
Bye.